Today we're diving into a crucial health topic that could save your life or someone close by. You should never ignore these symptoms. You have a high risk of having a stroke in the hours and days after a TIA, even if your symptoms go away. Transient ischemic attacks, or TIAs for short, and most importantly, how to prevent a subsequent full-blown stroke. You might have heard them called mini-strokes, but don't let that fool you. These little episodes pack a big punch when it comes to your health. Let's start with the basics. A TIA happens when blood flow to part of your brain gets temporarily blocked. It's like your brain's power cord gets unplugged for a moment. The symptoms are just like a stroke, but they don't stick around. They usually clear up within a few minutes to a few hours. Now, here's the kicker. About 500,000 people in the world experience a TIA every year. But that's not even the scariest part. Nearly 1 in 5 people who have a TIA will have a full-blown stroke within 90 days. And half of those strokes? They happen within just 2 days of the TIA. That's why doctors call TIAs warning strokes. So what should you look out for? The symptoms of a TIA can be remembered with the word FAST. Face. One side of your face might droop. You might not be able to smile properly. Arms. You might not be able to lift both arms and keep them up. One arm might feel weak or numb. Speech. Your words might come out slurred or garbled. You might have trouble speaking or understanding others. Time. If you notice any of these signs, it's time to call emergency services immediately. But there are other symptoms too. You might experience sudden weakness, numbness, or paralysis on one side of your body. Blindness in one or both eyes. Dizziness. Severe headache with no apparent cause. Now you might be wondering, who's at risk for a TIA? Well, the truth is, anyone can have one. But your risk goes up as you get older. In fact, stroke rates double every 10 years after age 55. And if you've had a stroke before, you need to be extra careful. A TIA could be signaling another stroke on the horizon. But here's some good news. Up to 80% of strokes after a TIA are preventable. That's right, 80%. But to prevent them, you need to act fast. If you think you're having a TIA, don't wait for the symptoms to go away. Get to a hospital right away. Ideally, you should be evaluated within 24 hours of when your symptoms started. At the hospital, here's what you can expect. The doctors will assess your symptoms and medical history. They'll take images of the blood vessels in your head and neck. You might have other tests like a CT scan, angiography, or MRI. Once they've confirmed it's a TIA, you'll probably have a follow-up visit with a neurologist. They'll assess your risk of future strokes and help you come up with a plan to prevent them. Now let's talk about what causes a TIA. Usually it's a blood clot that forms somewhere else in your body and travels to your brain. But it can also be caused by pieces of fatty material or even air bubbles. Certain things can increase your chances of having a TIA. Smoking, high blood pressure, obesity, high cholesterol levels, drinking too much alcohol, having an irregular heartbeat called atrial fibrillation, having diabetes. People over 55 and those of Asian, African, or Caribbean descent are also at higher risk. So how do we prevent TIAs and strokes? There are several strategies. Medications. These can help treat conditions that cause or contribute to TIAs. They might include blood thinners or drugs to lower your blood pressure or cholesterol. Endovascular procedures. These are minimally invasive treatments that work inside your blood vessels. They might be used to widen narrowed arteries that supply blood to your brain. Surgery. In some cases, surgery might be needed to clean out plaque from your arteries and create more space for blood to flow. But prevention isn't just about medical treatments. Lifestyle changes can make a big difference too. Quit smoking. Eat a healthy diet. Exercise regularly. Maintain a healthy weight. Limit alcohol consumption. Wait, there is more. But do not forget to hit the like button and subscribe down below. In this part of the video, we're talking in detail about how to avoid a stroke, whether you had a TIA or not. Now, you might be wondering, how high is that risk? Well, according to research, it's pretty significant. After a TIA, the risk of having a stroke is about 8% within the first week, 11.5% within the first month, and 17.3% within 3 months. About 1 in 3 people who have a TIA will eventually have a stroke, according to research. That is staggering 33%. Those are some scary numbers, right? But don't worry, because there's a lot you can do to lower your risk. First up, let's talk about medications. Your doctor will likely prescribe some meds to help prevent a stroke. These might include blood thinners to prevent clots, or drugs to lower your blood pressure or cholesterol. I know taking pills every day can be a pain, but these meds can be real lifesavers. Make sure you take them exactly as prescribed. But medications alone aren't enough. You've got to make some lifestyle changes too. Let's start with your diet. A healthy, plant-based diet rich in foods like leafy greens, whole grains, and beans can lower your overall stroke risk by about 10%. That's pretty impressive for just changing what you eat, right? Now, I know what some of you might be thinking, but I love my burgers and fries. I get it. You don't have to give up everything you love, but try to limit foods high in salt, saturated fat, and cholesterol. These can clog up your arteries and make your heart work harder. Instead, focus on filling your plate with colorful fruits and veggies, lean proteins, and whole grains. Next up, let's get moving. Regular exercise is a game changer when it comes to preventing strokes. Aim for at least 150 minutes of moderate intensity exercise each week. That's about 30 minutes a day, 5 days a week. It doesn't have to be anything fancy. You can start with walking or jogging at no cost. A brisk walk around your neighborhood works great. See the video above for HIIT form of running, which give the most benefits in few minutes. But if you're up for more, activities like swimming, cycling, or dancing are fantastic too. Now I know some of you might be thinking, but I've never been much of an exercise person. That's okay. Start small and work your way up. Even a little bit of movement is better than none at all. The key is to find something you enjoy, so you'll stick with it. Let's talk about smoking. If you're a smoker, quitting is one of the best things you can do to prevent a stroke. Smoking narrows your arteries and makes your blood more likely to clot. But I get it, quitting is tough. Don't be afraid to ask for help. There are lots of resources out there, from nicotine replacement therapy to support groups. Alcohol is another biggie. While a glass of red wine might be good for your heart, too much alcohol can lead to high blood pressure and irregular heartbeats. Try to keep it to no more than 1 drink a day for women and 2 for men. Now let's chat about stress. We all have it, but too much stress can be hard on your heart and brain. Find ways to relax that work for you. Maybe it's meditation, yoga, or just taking a few deep breaths when you feel overwhelmed. Remember, taking care of your mental health is just as important as taking care of your physical health. Okay, let's talk about numbers. High blood pressure is the #1 controllable risk factor for stroke. Aim to keep your blood pressure below 120/80. Current recommendation is systolic pressure of less than 120 mmHg and a diastolic pressure of less than 80 mmHg. If you have diabetes, managing your blood sugar is crucial. Work with your doctor to keep your A1C, that's a measure of your average blood sugar over time, below 7%. Now, here's something you might not have thought about. Sleep. Getting enough good quality sleep is super important for preventing strokes. Aim for 7 to 9 hours a night. If you're having trouble sleeping, or if you snore a lot, talk to your doctor. You might have sleep apnea, which can increase your risk of stroke. Let's talk about weight. Being overweight puts extra strain on your heart and blood vessels. But losing even a small amount of weight can make a big difference. Aim for a body mass index, BMI, between 18.5 and 24.9. But don't get too hung up on the numbers. The most important thing is to eat healthy and stay active. Now, I know we've covered a lot here, but don't feel overwhelmed. You don't have to make all these changes overnight. Start with 1 or 2 things and build from there. Every small step you take is a step towards preventing a stroke. Remember, you're not in this alone. Your healthcare team is there to support you. Don't be afraid to ask questions or voice concerns. They're there to help you succeed. And here's a final tip. Know the warning signs of a stroke. Remember the word FAST. F for face drooping, A for arm weakness, S for speech difficulty, and T for time to call emergency services. If you notice any of these signs in yourself or someone else, call for help right away. When it comes to strokes, every minute counts. Your roadmap to avoiding a stroke after a TIA. It might seem like a lot, but remember, every small change you make is a win for your brain health. You've got this. Stay healthy, stay positive, and keep that brain of yours in tip-top shape. Do not forget to check my video you see on screen on good and bad side of stents and angioplasty. Angioplasty and stenting are procedures that treat blocked or narrowed coronary arteries, the main blood vessels that supply the heart. We have over 500 videos on diabetes-related health topics, including metabolic syndrome. Do not forget to subscribe. Thanks very much for watching this video. See you in the next video.